Hello, welcome back to my channel. This is Gigi Love. Did you know that colorectal cancer affects the Black community proportionally more than any other racial group? We will explore various factors contributing to this disparity and the significance of regular screenings such as colonoscopies, which can play a pivotal role in identifying and treating colorectal cancer at its earliest stages. According to Centers for Disease Control and Prevention statistics, colorectal cancer is often thought of older people illness. But the truth is that colorectal cancer is affecting more and more young adults. Rates have increased 2% each year since 1990 for people under 50 years old. Unfortunately, young people get advanced cancer more often than older people. 40% of the people who died from colorectal cancer could have survived if they had early screening, detection, and diagnosis. About 75% of young onset cases are diagnosed between ages 40 to 49. Colorectal cancer has no symptoms. We know colorectal cancer diagnosis and deaths have a greater impact in Black, Indigenous, and people of color communities, for short BIPOC, BIPOC. Often BIPOC people run into barriers to screening that include finding and assessing high-quality care. The American College of Gastroenterology and the American Society of Gastrointestinal Endoscopy currently recommend colonoscopy screening tests for colon cancer at age 45 years for average risk African Americans. Why is there such an emphasis on the African American community? Because African Americans, according to CDC statistics on colorectal cancer, have the highest incidence and mortality rates of colorectal cancer of any ethnic group in the United States. No one knows exactly why colorectal cancer disproportionately affects the Black community, but about 20% are more likely to get colorectal cancer and about 40% more likely to die from it than other ethnic groups. Part of the problem is non-compliance with colon cancer screening protocols, with screening rates among African Americans at only 38%. Evidently, screening protocols are set up to detect and treat cancers early. Unfortunately, when people are not utilizing these screenings procedures early, the detection will be late and cancers are now at more advanced stages where curative options may no longer be available. There are other factors that affect, that causes the Black community not able to screen on time. Cultural and socioeconomic barriers also can stop those in the African American community from getting screened. Cultural barriers include mistrust of the medical community, their diet, exercise, and obesity, lack of information, low income, access to transportation. If you don't have transportation, then you can't go to screening. Lack of health insurance, limited access to care, especially those living in rural areas. Who is at risk of colon cancer? Age is number one risk factor. 90% of colon cancer cases occur in people, men and women equally, age 45 and older. The U.S. Preventive Services Task Force recommends that adults age 45 to 75 be screened for colorectal cancer. Regular screening beginning at age 45 is the key to preventing colorectal cancer and finding it early. Other risk factors include, but not limited to, the following: family history of colorectal cancer or adenomas, which is also known as polyps. Cigarette smoking can increase the risk of colon cancer death by 30 to 40%, possibly accounting for up to 12% of colon cancer fatalities. Obesity, sedentary lifestyle, regular exercise and maintaining a healthy weight play a vital role in preventing colorectal cancer. High-fat diet, especially one from mostly animal sources, is not good for us. A healthy diet low in red and processed meats, high in fruits, vegetables, and fiber can make a significant difference. Other risk factors include include heavy alcohol intake, ulcerative colitis or Crohn's disease, cancer of the uterus or ovaries before age 50, past removal of the gallbladder, past radiation therapy of the abdomen, diabetes, which can increase the risk of developing colorectal cancer 30% to 40%. But what if you don't have access to quality health care? You deserve the best care. So advocate for yourself. Seek information about local resources, community clinics, and free screenings that can help you detect and treat colorectal cancer early. Early screening colonoscopy is the key to preventing colorectal cancer and saving life. Early screening colonoscopy is very helpful in preventing some colorectal cancers. The earlier you find and remove the polyps before they turn into cancer, the better the outcome. Colonoscopy is the best test. It is used for screening. If a polyp is found, it can be biopsied and polyps can be removed. So it is good for procedure, diagnosis, and treatment. Colonoscopy can also be used to look for new tumors if you've had colon or rectal cancer. Some advanced cancers cannot be removed by colonoscopy because they are too big or have spread. This is why it's absolutely necessary to request the screening colonoscopy by age 45 to catch the colorectal disease early and remove the polyp before it turns into cancer. The good news is we can take action to reduce the risk and increase survival rates. Start by breaking the stigma surrounding colorectal cancer in our community. Talking openly about the disease and its symptoms can save lives. We should spread the word, educate our loved ones, listen to our body for gastrointestinal symptoms, attend the community health fairs, and promote regular screenings. Feel free to ask your physician questions about your health. You deserve a great health care, just like anyone else. I hope we provided you with reliable information that will help you make informed decisions as to being compliant with early colon cancer screening to improve your chances of early detection and consequently your survival rate. Moreover, this disease is highly preventable, although it is the third cause of cancer-related deaths in the community. Please make out time early than late to take care of yourself and take care of your life. Life is so precious. Get with your primary care doctor or your gastroenterologist, GI doctor, and ask how you can get a colonoscopy as soon as possible if you are 45 years or older. Don't wait until you have symptoms, because most of the time colorectal cancer is asymptomatic, which means has no symptoms. We intend to bring you more health information like this as part of self-care. If you like this health information, please subscribe, like, and share with friends and family. We'll welcome your comments and questions. Thank you for watching.